Even with all the medical technology we have today, high-resolution ultrasounds, advanced prenatal care, and constant monitoring, some twins are still not detected during pregnancy. That may sound impossible, almost unbelievable, but it happens more often than most people imagine. Imagine expecting one baby, preparing your life for a single arrival, only to discover at birth that there were two all along. This phenomenon raises curiosity, confusion, and sometimes awe. How can a second baby remain hidden in an era of medical precision? Is it a failure of technology, a limitation of the human body, or something more subtle? And why, in certain cultures, is this unexpected discovery not seen as a mistake or a shock but as a symbol of luck, abundance, or spiritual blessing? Today, we will explore the medical, technical, and cultural reasons behind this fascinating reality that continues to surprise families around the world. Pregnancy is often seen as a journey guided by science, measurements, and medical certainty. Ultrasounds give parents a glimpse into the womb, turning the unknown into something visible and measurable. Yet, despite these tools, the human body still holds mysteries that cannot always be predicted or controlled. In this video, we will break down the technical and medical explanations behind undetected twin pregnancies, showing how this situation can occur even today. We will also explore how different cultures interpret this phenomenon, sometimes viewing it not as an error, but as a sign of fortune or spiritual meaning. If you enjoy learning about the hidden complexities of the human body and the surprising intersections between science and belief, make sure to like this video, subscribe to the channel, and stay with us until the end. Pregnancy detection relies heavily on imaging technology, particularly ultrasound examinations, which use sound waves to create visual representations of what is happening inside the uterus. While ultrasounds are remarkably effective, they are not infallible. Their accuracy depends on timing, equipment quality, fetal positioning, and the skill of the technician performing the scan. In early pregnancy, especially during the first trimester, embryos are extremely small and can be difficult to distinguish clearly. When twins are present, one embryo may be positioned behind the other, making it harder to visualize separately. In some cases, the second fetus may be mistaken for part of the uterine wall or overlooked entirely. This is particularly true when ultrasounds are performed very early, before the pregnancy structures are fully developed and distinct enough to be clearly identified. Another important factor is the type of twins involved. Identical twins, also known as monozygotic twins, develop from a single fertilized egg that splits into two embryos. Depending on when this split occurs, the twins may share the same placenta or even the same amniotic sac. When twins share structures, distinguishing between them becomes more complex. A shared placenta can sometimes create the illusion of a single fetus during imaging, especially if one twin is smaller or less active. In such cases, the dominant twin may draw most of the attention during scans, while the other remains less visible. This does not mean the technology failed completely, but rather that the biological arrangement of the pregnancy made detection more challenging than usual. Fetal positioning also plays a critical role in where the twins are detected. Babies move constantly inside the womb, and their position can change from one scan to another. If one twin consistently positions itself behind the other or deep within the uterus, it may remain hidden during routine examinations. This is particularly common in later stages of pregnancy when space becomes limited. One fetus may be pressed closer to the spine or tucked behind the placenta, making it difficult for sound waves to bounce back clearly. As a result, the ultrasound image may appear incomplete or misleading, reinforcing the assumption that there is only one baby present. Maternal body composition can further influence ultrasound accuracy. Factors such as abdominal tissue thickness, uterine shape, and muscle tone can affect how clearly images are produced. In individuals with higher levels of abdominal tissue, ultrasound waves may not penetrate as effectively, reducing image clarity. This can obscure smaller or less active fetuses, especially if the pregnancy is not being closely monitored with frequent or high-resolution scans. In many cases, routine prenatal care focuses on identifying major health indicators rather than confirming fetal count multiple times, particularly when no complications are suspected. The frequency and timing of prenatal visits also matter significantly. In pregnancies considered low risk, ultrasounds may be limited to 1 or 2 routine scans. If twins are not identified during these key moments, they may go unnoticed throughout the remainder of the pregnancy. This is especially true if both fetuses are developing normally and there are no alarming symptoms such as unusual growth patterns or abnormal hormone levels. Without medical reasons to investigate further, healthcare providers may have no indication that a second fetus is present. Hormonal indicators, often used in early pregnancy tests, can sometimes provide subtle clues about multiple pregnancies. However, hormone levels vary widely between individuals, and elevated levels do not always signal twins. Conversely, normal hormone readings do not rule out multiple fetuses. This variability can contribute to undetected twin pregnancies, as there is no single hormonal threshold that definitively confirms or denies the presence of twins. Medical professionals must interpret these values in combination with imaging and physical assessments, which are not always conclusive. Another overlooked aspect is the phenomenon known as vanishing twin syndrome, where one twin stops developing early in pregnancy. In some cases, a second fetus initially appears and then seems to disappear in subsequent scans. This can lead healthcare providers to assume a singleton pregnancy moving forward. However, in rare situations, what appears to be a vanishing twin may actually be a fetus that becomes harder to detect as the pregnancy progresses, especially if growth patterns differ significantly between the two babies. Despite all these factors, it is important to emphasize that undetected twin pregnancies are not necessarily the result of negligence or outdated technology. Instead, they reflect the complexity of human biology and the limitations of interpreting dynamic, living systems. The womb is not a static environment, and no scan can capture every angle or detail perfectly. This unpredictability is what allows such surprises to occur. Even in modern medical settings that rely heavily on data, imaging, and standardized procedures, beyond technical limitations, there are medical circumstances that naturally complicate the detection of twins. One of these is significant size discrepancy between fetuses. In some twin pregnancies, one baby develops faster and larger than the other, a condition known as selective growth restriction. When this happens, the larger fetus becomes the primary focus during imaging, while the smaller one may appear less defined or be dismissed as a structural shadow. This disparity can persist throughout pregnancy, reinforcing the assumption of a single fetus. Since growth variations can still fall within acceptable medical ranges, they may not trigger further investigation unless additional risk factors emerge. Placental positioning also introduces complexity into prenatal imaging. When the placenta is located at the front of the uterus, known as an anterior placenta, it can block or distort ultrasound signals. This physical barrier may reduce visibility, especially for fetuses positioned behind it. If one twin remains consistently hidden by placental tissue, repeated scans may still fail to reveal its presence. This situation demonstrates how anatomy, rather than technology, often plays a decisive role in what can or cannot be detected during pregnancy. Medical protocols themselves can contribute unintentionally to undetected twins. Prenatal care guidelines are designed to balance thoroughness with practicality. Once a pregnancy is classified as low risk and a singleton diagnosis is established, there may be little justification for frequent or detailed imaging. This approach prioritizes efficiency and safety, but it also means that rare anomalies, such as hidden twins, can persist unnoticed. In this sense, undetected twins reflect systemic medical decision-making rather than individual error. In rare cases, uterine abnormalities may further obscure fetal detection. Variations such as a bicunuate uterus, where the uterus has 2 distinct chambers, can cause each fetus to occupy separate spaces. When this occurs, one chamber may be examined more thoroughly than the other, leading to incomplete visualization. This anatomical variation is uncommon but medically recognized, and it illustrates how structural differences can influence diagnostic outcomes. When combined with limited imaging angles, such conditions create an environment where a second fetus can remain undetected for months. The psychological aspect of prenatal diagnosis also deserves attention. Once both parents and medical professionals accept the idea of a single pregnancy, confirmation bias can subtly shape interpretation. Images, measurements, and symptoms are unconsciously interpreted to support the initial conclusion. If no obvious contradictions arise, the assumption remains unchallenged. This does not imply intentional oversight, but rather highlights how human perception interacts with medical data. Even advanced technology requires interpretation, and interpretation is influenced by expectations formed early in the diagnostic process. Cultural context adds another dimension to how undetected twin pregnancies are understood. In many societies, the unexpected birth of twins is not framed as a medical anomaly but as a meaningful event. Some cultures associate twins with prosperity, protection, or spiritual favor. Rather than focusing on how the second baby was missed, attention shifts to what the arrival symbolizes. This perspective does not reject science, but complements it with symbolic meaning, transforming surprise into celebration. In these contexts, mystery is not something to be eliminated, but something to be honored. This intersection between medicine and meaning reveals an important truth. Not all experiences are defined solely by technical explanations. While science can describe how undetected twins occur, it does not fully explain how people feel when confronted with such surprises. The coexistence of medical reasoning and cultural interpretation reflects humanity's ongoing effort to understand life not just through data but through significance. Undetected twins remind us that even in controlled environments, life retains the ability to surprise, challenge assumptions, and inspire wonder. Ultimately, the persistence of undetected twin pregnancies underscores the limitations inherent in predicting biological processes. Despite continuous advancements, medicine operates within probabilities rather than certainties. Every pregnancy unfolds uniquely, shaped by countless variables that cannot always be anticipated or measured. The hidden twin becomes a symbol of this unpredictability, a quiet reminder that life does not always reveal itself on schedule. In acknowledging these limits, science does not lose credibility, instead it gains humility. And within that humility, there is room for awe, interpretation, and the recognition that some aspects of human existence remain beautifully unpredictable. Undetected twin pregnancies challenge our belief that modern science can explain and foresee everything. They show us that even with advanced technology, the human body still holds secrets that unfold in their own time. What begins as a medical curiosity often becomes a powerful emotional and cultural experience, reshaping expectations in an instant. In some traditions, this surprise is welcomed as a sign of abundance, protection, or destiny at work. Whether viewed through a scientific lens or a symbolic one, the hidden twin reminds us that life is not only measured by scans and statistics, but also by meaning and interpretation. Perhaps the real lesson is not why something was missed, but how moments of surprise invite us to stay humble, curious, and open to the mystery that still exists within human life.